I am Dr. Sunil Modi. I am an interventional cardiologist and a senior consultant at Indraprasth Apollo Hospital, New Delhi. Despite of all the advancements and very high-tech progress in last 2 or 3 decades, heart failure continues to rise and it continues to be a growing problem. Whereas other cardiac issues are getting lesser and lesser, but the heart failure incidence is increasing. That's mainly because of aging population. People are living longer, so because they are living longer, they are more incidence of heart failure, because heart failure is a disease of mostly elderly age. And also we are not allowing them to die during heart attack with the better and better techniques, so they are saved during heart attacks so that they are left with the heart damage and they develop heart failure later. So this is the only cardiac syndrome which is still increasing in numbers, prevalence. Now last 2 decades or 3 decades have seen dramatic changes and improvements in the management of heart failure, particularly in the drug treatment of heart failure. And now we have a very standard line of treatment of heart failure, to which they respond very well, and almost like 60 to 70% mortality has been cut down with the use of those drugs. We call them guideline directed medical therapy. There are guidelines clearly written, told in the meeting and conferences several times. So if physicians use those guidelines and use proper medicines in proper doses, they can save almost like 6 to 7 out of 10 patients of heart failure. The message is to know those guidelines, which I'm sure most of the physicians know, but more important is to utilize and implement those guidelines in their patients so that they can save the life of patients from heart failure.